Welcome to the Sunstone Health Podcast, hosted by storyteller Justin Starbird and Josh Resnikoff, co-founder and CEO of TMA Precision Health. This podcast brings you inside the movement that's reshaping how we diagnose, treat, and care for patients who have spent years searching for answers. At the heart of it all, TMA's mission is to end the diagnostic odyssey through AI, data-driven insights, and expert human guidance.
Welcome back to the Sunstone Podcast. My name is Justin Starbird, and today I am excited to welcome Director of Operations for TMA Precision Health, Sofia Raldo. Sofia, great to see you. Thanks for joining me today.
Thank you so much, Justin. I'm really happy to be here, and it's exciting to look back at where we started and get to share a little bit of the story and what this mission means to me.
Yeah, speaking of that journey and the story, it is so interesting to hear how you became part of TMA and got to meet and get to know the CEO and founder, Josh Resnikoff. Talk a little bit about, how you got introduced to TMA Precision Health.
Yeah, well, first I was born and raised in Colombia, so healthcare has always been part of my life. So my dad, Wilford, he is the CEO and co-founder of Promidan. We have a healthcare institution and a clinic back there in Medellin. First of all, I grew up surrounded by doctors, patients, and the reality of what families go through when answers are hard to find. So that background really shaped how I see healthcare. And then I was working for Promidan back at the time, and I was just translating some of my dad's meetings with Josh, and that's how I actually got introduced to Josh in the first place. Then they introduced me because I was director of projects back in Promidan, and we started the pilot called TMA, which was sampling kids for whole genome sequencing, kids with epilepsy. So we worked for that for like a year, and then I got to meet Josh. He went to Colombia and we had dinner, and it was great. So then I decided to move to the US. It was kind of like a big step for me, but I wanted to do my MBA. I always wanted to challenge myself and step outside of my comfort zone, like new home, new people, new culture. And I also wanted to understand how US operations works, since they're so different from what I learned in Colombia. So understanding what perspective helped me build bridges between regions, scale our processes, and make our systems work for families everywhere.
Yeah. It's really interesting that you're able to do that and make that journey to the U.S. You also studied here, right? And got your MBA here in the United States. What did you study while you were in school?
I did my MBA at Suffolk University in Boston, and I focused it in healthcare. It was such a great experience because it really helped me connect everything I was already passionate about, operations, people. So it wasn't just about learning business concepts, it was about understanding how to make healthcare work better. So I got to see how structure, strategy, and empathy can all come together to actually make systems more efficient and human at the same time.
Sofia, after school, you were able to reconnect with Josh and really jump into the role of operations manager. What has that been like here at TMA to manage all the different elements of the business?
Yeah. Well, as operations manager, my role is to make sure every part of what we do runs smoothly, from when a family receives a kit to when they get the results. So that includes logistics, vendor partnerships, compliance, and coordination between our teams. Also like in the US and in Latin America, it's kind of like behind the scenes, but I love it because every small improvement means the family get their answers faster. It's also about building systems that can grow while keeping that personal connection. I think that that's what makes TMA special. We never lose the sight of the families that we serve.
Yeah, that's so important because you're working with families that have gone through so much already, and so certainly to make the process as smooth as possible is so rewarding. And I feel like that's part of the mission that drew you into TMA, right? Why did you want to become part of the rare disease space?
Yeah, honestly, I've always cared about helping people find clarity in chaos, and that's what the rare disease space is all about. So many families go through years of confusion, misdiagnosis, and uncertainty. When I first heard about TMA's mission to end the diagnostic odyssey, it immediately resonated. It felt deeply personal because I'd seen that same struggle in my own country when access to answers is even harder to get to it. So I wanted to be part of changing that story.
Yeah. And you've jumped in, both feet into the deep end here, to work with a team and understand the environment. Of course, it's still a startup, although a couple of years into that startup process. What is the environment like to work with the team that's kind of based all over the world?
Yeah, we were completely remotely back then, and we are now. So even though it's remote, there is so much energy and connection. Everyone is working toward the same mission, even if we're in different places, different time zones. So that kind of passion is what built the foundation for everything TMA is today.
Yeah. How did you end up meeting Josh? Talk a little bit about that story.
Yeah, so I actually met Josh through my dad. Well, it's a funny story because my dad was having meetings with him and I was helping him translate, and that's how I got introduced to TMA's pilot project in Colombia. So as I said, I was a project director, and I thought that would be something really meaningful. That was something that they were doing. So I jumped in it head first, and I started helping with the pilot, calling families, coordinating logistics, and seeing firsthand the hope people had. Yeah, it was.
That's amazing.
Really rewarding when we actually got to meet them. When we were sampling, they were whispering and saying like, "Oh, we're gonna finally find an answer," or they were like super excited about it. They will have to travel from the countryside for like hours to get the sampling. So it was just great to be part of it.
Yeah. Thinking about the commitment that those families showed to travel from all across Colombia to, have those swabs. And now you're, we just finished the Epilepsy Awareness Day where families came from all over the U.S. to be swabbed. What has that commitment, signaled to you about the company's potential and really the belief in the mission of what TMA is doing?
Yeah. Well, when it was in Colombia, it just felt incredible. And coming here to the U.S. and seeing that you can find that all around the world, like not only in Colombia when I was born, but also here in the United States, and they have been in that diagnostic odyssey for a whole time, and they might not know what they really have, or some of them might know, but they're still looking for answers, learning. That was a powerful energy. Like I felt that expo was full of hope. So I loved to be part of it, and I love that we got to be there, really ground ourselves with the community, and get to meet those families that have been going through a lot and really get to help them.
Yeah. So one of the things I think is so fascinating is you did the pilot during the lockdown, and you did it right in the middle of the pandemic, and then fast forward to just this week, you just did another, smaller pilot here in Anaheim for Epilepsy Awareness Day. Talk a little bit about what the difference between the two are, and some of the lessons you learned from the pilot and you've been able to apply to the other 450 families that you've been able to work with.
Well, first, the way that we do this sampling, I think that's the first thing people or families care about, because some of them, they don't do needles, or kids have tried needles before and that didn't work. So that pilot back in Medellin helped us to learn and to understand what it really works. So for this swab, it can take 5 to 10 minutes just to get the saliva from the patient, and that's it. But when we did it back in Colombia, at first we started with needles, we did blood, and it didn't work really well. So first that exercise that we did back in Colombia helped us to learn that, and also how we approach families, how we connect with them. That really gave us the first-hand experience, and also do that everything runs smoothly on approaching them, onboarding them, and getting to help them. I think that this was a smooth experience. What we did here and everything worked really well, and we really had a lot of help from the Brad and Candy. They put us in a good spot in the Epilepsy Awareness Day, and we got to have families directly to us. They were actually looking for us. It was super funny. They were, "Oh, you were the one that were taking whole genome sequencing," and so we got to take up to 50 samples. So, yeah.
Well, is that what's the difference between of course it was easier, right, to take swabs of the inside of a child's mouth versus having to draw blood, but what was the energy like? What did that feel like to be helping all those families?
This energy here at the expo was amazing. There was a lot of families, kids, but you didn't feel like they were sick, because they were kind of happy to be there. They were dancing around the expo. They were going through everything. I will just ask them how the expo has been so far, and they were like, "Great, I love it." And I think that filled my heart so much.
Yeah. What does that help to do to, propel you forward? Going back to the question earlier about, believing in the mission and, seeing the company start to take off. How, does this, fill that cup up? Does that, give you more excitement to go back to work and, work even harder?
Absolutely. We really think that we grounded ourselves in the community. They got to know us and we got to help them. So it's super excited. It was super excited to be here. We're hopefully gonna go to the next one and get to help families. Yeah, I think that a lot of families were just looking for us, and they wanted to know what we do, and they wanted to understand it, and they wanted to share it with others, other people. So I think that we definitely should come to the next one and just getting to know the community. I think that's the most powerful thing, connect with the community.
Yeah, I think one of the takeaways for sure was the lengths that people will go to find answers for their families. I feel like that was such a huge piece of it. We had people from all over the country come to the event and with some very rare diagnosis, and they were still coming to you for more answers. At the end of the day, what are you hoping that families are able to take away from this and get as a result?
Well, the thing is that because when you have lived years without answers, like any chance is worth it, and this is why they like travel all the way to the expo. So those parents were just looking for a diagnosis. They weren't just looking for a diagnosis, they were looking for a direction. So they want to understand what is happening with their children, to have hope that maybe there was something that could be done.
Yeah.
So that's what makes this work so meaningful. Like, I would say it's not about data points, it's about giving people hope and control over their own history again.
Yeah. What was setting up the logistics like for, getting the team there, making sure all your I's are dotted and T's are crossed? From your perspective, this was a pretty big undertaking.
Yeah. Well, it showed me how much is possible when technology and purposes come together. So we were navigating like shipping things, like we had to send everything to the expo that we could get it on time. We had to organize all the food. We had to make sure all the kids, we will get them, and also we will have to make sure that all the team will get to the expo, which was a big challenge this time because of flights canceled and everything. But like it showed us that even if everything could go wrong, we didn't stop. So I think that where TMA is adaptable, we can, and it's scalable, and we can do everything to make that mission really true. So we just don't talk about helping people. We do whatever it takes to reach them.
Yeah.
To reach them.
So what's next? What are you most excited about? What are you looking forward to, Sofia?
Well, I'm thinking that I'm looking for is giving answer to those families and get to help them, and of course scaling with AI. We can reach to more people now who are still in that diagnostic odyssey. Even if we get more partnership with employers, we can find more people that can get access to our services. Well, so I think it's possible. We have the technology, the partnerships, and it's most important, we have the heart. I've seen it from Colombia to Boston. Our team truly believes in the mission, and that's what will make it succeed.
That's incredible. Sofia, thank you so much for sharing your perspective. Thank you for talking a little bit about your journey on this campaign to grow the company. It's really special, and certainly we couldn't do it without you.
I know, I'm super excited to be here. Thank you for having me, and I just feel gratitude, like to our team, to the families who trust us, to this journey that's taught me so much. I think it's incredible to see how far we've come, and I'm even more excited for what's ahead.
Yeah. Well, I really appreciate you being our guest today. We're going to have to do a recap, a full recap of the Epilepsy Awareness Day 2025 in Anaheim here in the next week or so. So that'll be wonderful to hear your perspective, get Josh on to hear his perspective. So this was great.
Absolutely. Thank you so much.
On behalf of my guest today, Sofia Geraldo, the Director of Operations for TMA Precision Health, you've been listening to the Sunstone Health Podcast. Until next time.